You can put on the headphones if you want.
Why? What do they help with?
When calls come in, so I can hear the questions better.
I like the idea they have because it makes me look like I'm on radio.
Okay. A pleasant good morning to you all out there, listener. You're welcome to another thrilling and exciting edition of the program Let's Talk Health, your one-stop shop for all your medical needs and concerns on Radio Nigeria Highland 101.5 FM. Just my name is Stephen Ego. Good morning and welcome to the program. Today on the program Let's Talk Health, we shall be discussing vesicovaginal fistula, also known as VVF. It is a serious disability that can be experienced by women after childbirth. It is defined as a hole that develops between the vagina and the bladder, resulting in uncontrollable leakage of urine through the vagina. Women and girls with this disability are often abandoned by their husbands and isolated from the community due to the smell and associated shame of urine leakage. The WHO, that's the World Health Organization, estimated that 2 million young women live with untreated obstetric fistula in Asia and sub-Saharan Africa. Each year, 50,000 to 100,000 worldwide are affected by obstetric fistula. Nigeria is said to have the highest prevalence rate of vesicovaginal fistula in the world, with an alleged number of between 400,000 to 800,000 women living with the scourge. However, this type of disability can be avoided by changing the attitudes of the community towards women. All right, listener, once more, good morning and welcome on the program. And to discuss VVF with me in the studio, I have two guests. The first of which is Dr. Ene George of the OFSTAR Project, which is the Obstetric Fistula Surgical Therapy and Rehabilitation Project, California, USA. Dr. Ene, good morning and welcome on the program.
Good morning and thanks for having me.
And also Dr. Sunday Lengmang, Fistula Surgeon and Project Director, Evangelical Vesicovaginal Fistula Center, Bingham University Teaching Hospital, Jos. Good morning, Dr. Sunday. Good morning and welcome.
Good morning and thanks for having me.
All right. So, listener, the phone lines will be open during the course of the program for you to call in and contribute on the program or to ask any of the good doctors a question or two. I will start with you, first of all, Dr. Sunday. Can you tell us more about vesicovaginal fistula, VVF?
Vesicovaginal fistula, it's a problem affecting women in their reproductive age. And for us in Nigeria and most of Africa and South Asia, where it is most prevalent, it results from prolonged obstructed labor. So in that case, the girl is not actually as old as she's supposed to be, and so her pelvis is not wide enough to permit the birth of a child. And that's the usual thing that happens. So there's an obstruction. The head of the baby will not be able to pass through the pelvis, and that leads to destruction of the bladder and the vaginal tissue, leading to VVF. Or on the other hand, it can obstruct the rectum, and then there will also be what we call RVF. For VVF, it's urine that leaks 24 hours, and for RVF, is feces. In very bad situations, you can have a mixture of both occurring. We also have some other comorbid conditions like foot drop. The women are not able to walk or they are limping. And that tends to have a lot of psychological, mental, physical problem on the women.
Okay. I'll stay with you, Dr. Sunday. What are the causes of VVF?
Well, I started by talking about prolonged obstructed labor. That accounts for like 85% and to some in other areas up to 90 and 95%. But apart from that, we have harmful cultural practices like the female genital cutting. And in the far northern part of Nigeria, northeast and northwest, we also have the gishiri cut. Then we also have trauma, like any injury to the pelvis can lead to it. We also have cancers, like cancer of the cervix, cancer of the bladder can eat up into the bladder and cause that. And in rare conditions, we can have infections like the lymphogranuloma venereum. We have also seen iatrogenic causes, that is to say, people doing surgeries that they are not really qualified to offer, or in situations where you don't have the minimum equipment to provide the surgery, mistakes can lead to the development of fistula.
All right. Thank you, Doctor. Still with you, Dr. Sunday. In my introduction, I mentioned the prevalence rate in Nigeria being very high. So I'm going to ask you two questions in one. What is the prevalence rate in Plateau State, and why is the prevalent rate overall in Nigeria high?
Well, talking generally about the prevalence rate, many years ago we estimated 400 to 800,000. Some even say the million. But in recent reviews, we are thinking that the prevalence is coming down. From a review that we did at the national level, Federal Ministry of Health, we agreed that the most likely number right now is about 150,000. So it's just an estimate. Nobody has done a proper community-based study to find out the exact figures. In Plateau State, again, we do not know the figures because we've not definitely studied it. But in 2008, the DSM revealed that the Middle Belt had the highest rate. In recent times, I traveled to northeastern Nigeria, northwestern, then south and southeast to do surgery. And from what I'm seeing from the data that I am personally collecting, I think northwest and northeast is higher than north central. So north central is like the third in the different zones of Nigeria.
Okay. But what would you attribute for the high prevalence rate in Nigeria overall?
The high prevalence rate, fistula is closely associated with underdevelopment and poverty. And after poverty, the next big issue is how prepared the health system is and well equipped it is to respond to the needs of women. So the biggest problem is poverty. The second biggest problem is a poor health system.
Okay, thank you very much. Listener, if you just joined us, this is your one-stop shop for all your medical needs and concerns on radio. It's Let's Talk Health on Radio Nigeria Highland 101.5 FM. And today we are discussing fiscal vaginal fistula. And I have two guests with me. I'm going to my second guest now, Dr. Ene George of the OFSTAR Project. OFSTAR stands for Obstetric, Fistula, Surgical Therapy and Rehabilitation Project from California in USA. So, Dr. George, what is your organization all about? And it helps women with VVS. So can you tell us more about your organization and what you do?
So Dr. Lengmang and I have been working together for about 11 years now doing VVF. I come once a year during the Evangel Hospital reunion to work with him and help these women. The OFSTAR Project, it's a foundation that was set up by myself and my husband to facilitate the ability for us to keep coming back to Nigeria to help. So obstetric fistula has been so devastating and affecting some of the most vulnerable members of our society. I figure as a woman and as a Nigerian woman that it is important for me to give back to these women whom I consider my sisters. And so we set up this foundation so that we can continue the work that we have been doing over the past few years, because, of course, financially it's pretty strenuous. And with the foundation established, we're able to raise funds to provide surgical equipment, funding for the project, and I said it's surgical therapy and rehabilitation, because it's not just operating on these women and fixing their problem. It's being able to rehabilitate them in such a way that they can be reintroduced into society. Like you said, a lot of them end up being abandoned by their families and they become suicidal outcasts, like pariahs. So the center in Evangel has a rehab program for them that also needs funding. Okay, Evangel has done an absolutely amazing job in looking after these women. They provide surgery for the women, but the surgery that they provide is free. So they have to have a means of getting help. Okay, these women are not people who can usually pay for anything that they get. So they come into the hospital, they get their surgical therapy free. They can stay and learn a skill that can help them support themselves when they leave, and that's free. They're fed for free. And how is this sustained? It's completely sustained by donations that the center gets from people like the OFSTAR Project or other bigger foundations all over the world. And that's basically why this foundation was set up. Yeah.
Okay. So how can women with VVF benefit from the services of your organization? How do they access?
So we work in collaboration. Dr. Lengmang and the Evangel VVF Center are our Nigerian counterparts. And so the way that the women benefit through us is that we're able to provide surgical equipment and supplies that are needed for these surgeries. So what we do is we gather as much surgical supplies as we can, and when we come down for the reunion, we bring those supplies with us. So we're providing surgical equipment. Okay. Mostly, yeah.
All right, thank you, Dr. George. Listen, if you're just joining us, this is your one-stop shop for all your medical needs and concerns on radio. It's the program Let's Talk Health on Radio Nigeria Highland 101.5 FM. And today we're discussing VVF, which stands for Vesical Vaginal Fistula, and all the problems that accompanies it. The WHO, that's the World Health Organization, has estimated that 2 million young women live with untreated obstetric fistula in Asia and sub-Saharan Africa. Each year, 50,000 to 100,000 worldwide are affected by obstetric fistula. And in the studio, my guests are Dr. Ene George of the OFSTAR Project, which is the Obstetric Fistula Surgical Therapy and Rehabilitation Project, California, USA, and Dr. Sunday Lengmang, Fistula Surgeon and Project Director, Evangelical Vesical Vaginal Fistula Center, Bingham University Teaching Hospital, Jos. Listener, the phone lines are now open. You can call in and contribute on the program or ask the good doctors a question or two. The number to call is 081 000 81124, 081 000 81124. Let's get the conversation going on the issue of VVF. Back to you, Dr. Sunday. What are the complications associated with VVF?
Oh, there are many complications. First, the immediate symptoms are continuous leakage of urine, and because urine is offensive, there's a smell around them, and that makes them to want to isolate themselves from others. It isolates them from social contacts, from religious activities, and even from livelihood programs. It leads to divorce, which is separation between the husband and the wife. And in this part of the world, of course, the worth of much women is tightly linked with whether they are married or not. Even family members tend to be tired of them, and so they become isolated and ostracized. That's the physical one. Secondly, it can affect, like I mentioned before, their posture and the way they walk. If it affects the nerves of the lower limbs, they can even be paralyzed. Some of them can't even walk at all. They may need a wheelchair. Thirdly, we can also talk about psychological problems. Most of them don't have a sense of self-worth, and it begins a kind of negative spiral on life where they lose their livelihood, they lose their loved ones, they lose their job opportunities, and then it might eventually lead to depression, and depression can lead to suicide or attempted suicide, which we have had several of them in that area. Apart from that, it can also affect fertility. Some of them are not able to see their menses anymore, and they are not able to get their children. One of the other complications is that most of the women that have prolonged obstructed labor end up losing the child that they are carrying. So by the time that the child is born, is already stillborn, either fresh or still stillborn. And this tend to affect the women very seriously. So these are some of the complications.
Okay, thank you, Dr. Sunday Lengmang, Fistula Surgeon and Project Director, Evangelical Vesical Vaginal Fistula Center, Bingham University Teaching Hospital, Jos. Thank you for that. Listener, the lines are open, 081 000 81124, 081 000 81124. Call in and contribute on the program and get to ask the doctors a question or two. Okay, still with you, Dr. Sunday. Diagnosis. How is VVF diagnosed?
Well, VVF is diagnosed by doing very simple physical examination, but before we get to that, we have to start from the history. And like I've already listed, the commonest causes to do with labor and delivery. So you want to know if the woman has been pregnant, she's delivered, how the delivery went through, and how many days she spent in labor. That gives an idea of whether she had prolonged labor or not. Then one also has to know the type of surgery that was done. If she had surgery, was a cesarean section, or if she has had some other pelvic surgery, and where it was done, whether it was done in a hospital or in a place where it was ill-equipped. Then one need to ask about the real symptoms, whether they are continent of urine or they are incontinent of urine. And after you've taken all those history, then you do a simple examination where you put the woman on a bed in the lithotomy position. That's to say she lies on the back, and you put a dye through the urethra and watch to see if that dye will come out. And if it comes out of the vagina, it tells you that that is where the fistula is. Apart from physical examination, we often do some investigation like cystoscopy. We also do intravenous urography and other more sophisticated tests to kind of show us exactly where the fistula is and how big the fistula is and what other associated damage has been done.
Okay. I'll get back to you, Dr. Sunday. But to you, Dr. Ene, OFSTAR Project, what are the challenges your organization has encountered in regards discharging your services here? Some of the challenges OFSTAR has encountered.
I think that one of the major challenges that we have is the ability to bring the supplies that are needed for help here. Wouldn't you say so? Mm. Yeah. So that has been a major challenge. I think that it's this year we were able to bring like a few more things than we have been, because we're coming in through the airports. You have to deal with the system, you have to deal with customs, you have to deal with immigration, and unfortunately for us, the way our system is set up, it can be difficult to get this help through. For many years, the hospital has had difficulty getting help from other organizations for that simple reason. So it can be a bit of a challenge. And then there's the other thing about if you're trying to send help remotely, there's no guarantee that it's going to end up where you want it to go. So if you don't have a physical person who can actually bring the help to the hospital, it can be tricky.
Okay.
Being able to navigate the system.
Okay, still with you, Dr. Ene. How is VVF treated?
Okay, so the VVF is usually a surgical problem. Okay, and it's usually the teaching is that it can be fixed by a simple surgery, and most fistulas are successful. Okay, so this woman can live with this condition for many years, but she has a simple surgery and she's fine. Okay, it's purely surgical, and that's another reason why there's a little bit of a barrier to care, because like Dr. Lengmang alluded, most of the women who are affected by VVF are the poorest of the poor. They're in remote areas, and so if they cannot access a center where they have the access to the experienced care to repair this fistulas, there's going to be an issue. Okay, there are very few cases where a VVF or a fistula would close spontaneously. It has been known to happen, but that's very, very rare. But it's usually surgical, and most fistulas can be fixed surgically.
Okay. All right, listener, it's still your one-stop shop for all your medical needs and concerns on radio. It's the program Let's Talk Health on Radio Nigeria's Highland 101.5 FM Jos, and today we are discussing vaginal fistula, that is VVF, and the lines are open for you to contribute on the program. 081-000-81124. That's 081-000-81124. I hope we are not having a problem with the network of the line itself, because usually at this point in time we have a barrage of calls coming in. Dr. George, I will stay with you. Dr. Ene George, sorry. Dr. Ed, I'll stay with you. Prevention now.
Okay.
Let's talk about prevention. We've talked about causes, diagnosis, treatment, prevention.
So, like the old saying goes, prevention is better than cure. Okay, so prevention of fistulas is simply adequate access to controlled deliveries. So when a woman goes into labor, the end point is that you get the baby out safely. If there is no access to good health care or experienced health care and the baby gets stuck, then the baby, you have a problem. So ways to prevent VVF are, number one, delaying early childhood marriages, which is very common in societies where you have this problem. So if you can delay early childhood marriages so that a woman's body is physically mature.
Okay, sorry to interject, Dr. Ene. We have a call coming in. Hello, good morning. Yes, hello, good morning. You're onto the program Let's Talk Health. Yes, hello, I can hear you. Okay, Barrister Frank, good morning and welcome on the program. Hello? All right, we seem to have lost that call from Barrister Frank. Do endeavor to call back. The number still remains 081 000 81124. That's 081 000 81124. Back to you, Dr. Ene.
Okay, so I was saying allowing a woman's body to mature so that it's adequate for childbirth. So there's that. But when you're talking about delaying early childhood marriage, you're talking about cultural practices too that have been ingrained for a long time. So maybe that's something that will take generations to change. In the meantime, we can meet our patients at the point of their need, which is providing access to female healthcare, maternal healthcare, so that when a woman or a young girl is pregnant, she actually is able to access, the care that she needs. So we need to educate, like traditional birth attendants, the traditional people who most women deliver at home in Nigeria. I think about 47% of women still deliver at home. Right. So the women the people who are attending these births need to be educated on just basic things like how long are you going to allow a woman to be in labor before you look for adequate health. There was a slogan that Dr. Lengmang came up with many years ago that said, "Do not let the sun set on a woman in labor," and just simple things like that. So if we're able to prevent women from getting pregnant too early, and if they do get pregnant, early or not early, a woman should have just the basic access to good health care. Okay, in the Western world, obstetric fistulas are all but eliminated, and that happened with the advent of access to cesarean sections for every woman. Okay, and access to cesarean sections is very limited because we don't have the infrastructure and we don't have enough doctors in the rural areas, and that can take a woman from the point of her baby gets stuck and this baby can be delivered efficiently within a short time while the baby is still alive.
Okay. Yeah. Okay. Dr. Sunday, back to you. We're talking about healthcare. How can healthcare? Do you think the country is doing enough in regards healthcare vis-a-vis VVF, our issue for today?
Well, like we mentioned, the main thing that causes fistula is poverty. This next is the health system. The Federal Ministry of Health has done quite a lot together with development partners in the recent past to see how they can respond to the need of VVF. But the area that they have worked the most is in the area of treatment. Currently, they've been able to set up about 3 national VVF centers. The first in Abakaliki, the second in Katsina, and the third one is in Ningi in Bauchi State. And it's working seriously to set up 3 others so that each of the geopolitical zone will have a center of excellence that's providing this care. And now they've encouraged different states to also set up so that at least in each of the states eventually we'll have a VVF center. But the current situation is that we have only 16 VVF centers in Nigeria serving the entire country. And even among the 16, it's only 5 that are offering services 24 hours a day and throughout the year. So most of the others offer service like maybe 4 times in a year where they pull patients and they do that. So in terms of the response to the need of the patients that have fistula, there has been an improvement. But in terms of general care to women in childbearing age who need antenatal care service and delivery services and cesarean section, I think we have a lot to improve in that area, because even where these services are available, the services are not free. And for a woman that is poor and cannot afford it, then of course she has now a barrier, a financial barrier, blocking her from having that access. There are some of the states in northern Nigeria that have instituted free antenatal and free obstetric services. But even when you go to review those programs, you see that they are expected to buy hand gloves, to buy IV cannula, to buy other things to be able to have the services. So at the end of the day, although it was intended to be free, but it's not really free. So we need to do a lot in that area of prevention to be able to help in the area of responding to the fistula needs in Nigeria.
Okay, stay with you, Dr. Sunday. Where can women with VVF access treatment and care?
In Plateau State, our VVF center is the place to go. And actually, our VVF center in Jos is a national and even international referral center. We started off about 27 years ago. And like Dr. Ene George said, we offer the services free. We even provide meals for the patients who cannot even afford. And so you get patients from all parts of the country, because we have developed expertise in very complicated cases. And Dr. Ene George is one of our partners. We have other partners coming. And through the link with them, we've been able to specialize in very complicated fistula surgery. So many times when fistulas fail in other parts of the country, they tend to be referred here. But apart from here, like I mentioned, the National VVF Hospital in Katsina provides care throughout the year. The National Fistula Center in Ningi in Bauchi State also provides services. The first national hospital is in Abakaliki, taking care of the southeast zone. The first fistula hospital in Nigeria is a mission hospital in Uyo in Akwa Ibom State, and it's also open to provide services. Then Kano State and Jigawa, Sokoto, and other states have some form of services.
Okay. All right. Thank you very much, Dr. Sunday. We are running out of time on the program. So before we round off on the program, I want to give you a minute to just talk to the listener, to government, about VVF.
Well, the appeal I will give is that they should take advantage of the free services that we offer, so that they don't have to live with a disease that is very curable. And then people working in communities should encourage them to access care in antenatal and deliver in the hospital.
Okay. And of course, I started off with you, Dr. Sunday. I will round off with Dr. Ene George, giving women the final say in this matter. Dr. Ene, what would you say finally about VVF and for the listener out there?
So obstetric fistula is 100% preventable. It's highly preventable and it should not exist today. I want people to know that this is more like it's almost like a hidden epidemic, and we should remove the stigma that we allow these women to live with, so that they can feel free to access care for something that is highly preventable and also most likely very curable with surgical care.
All right. Thank you, listener. That's with that statement, we draw curtains on the program for today. I want to thank my guest, Dr. Ene George of the OFSTAR Project, the Obstetric, Fistula, Surgical Therapy and Rehabilitation Project, California, USA, for coming on the program. Doctor, thank you very much.
Thank you very much for having me.
Also, Dr. Sunday Lengmang, Fistula Surgeon and Project Director, Evangelical Vesical Vaginal Fistula Center, Bingham University Teaching Hospital, Jos. Doctor, thank you for coming on the program.
Thank you very much.
And also my thanks to my producer, Martha Menasara, and Barrister Frank for calling in. We do sincerely apologize for the line being giving us one or two issues, preventing other callers from calling on the program. My name is Stephen Iggo. Thank you for joining us on this edition of the program. Do join us same time next week so we can talk health. Goodbye for now. Thank you very much.
Thank you very much, Stephen.
You're welcome.
That was cool.
Look at that, we did radio. 11 years later.